A local advocacy group says Michigan needs to increase the amount of money it spends on tobacco prevention programs. A recent report found the state allocates less than 2% of what the CDC suggests lawmakers put toward evidence-based practices. However, that organization believes new legislation can improve the gap. As Michigan lawmakers reconvene in Lansing,
we just hope that the elected officials agree and prioritize their kids and their health.
Jody Radke says they face a historic opportunity this legislative session that could help fewer people in the state smoke or vape.
Michigan trends along with a number of our states that's referred to as tobacco nation. It includes states where they're the 12 states where smoking is 50% more common than in the rest of the country. And those 12 states are 21% of the total population, but have 28% of the total smokers across the country.
She co-chairs the Keep My Kids Tobacco Free Alliance and calls Michigan's use of the substance a problem. Her organization says each year the habit kills more than 16,000 people and costs the state $5.3 billion in direct health care needs. Radke partly blames a lack of investment since 2012 in tobacco prevention programs for those numbers. According to a report released earlier this month from the Campaign for Tobacco-Free Kids, Michigan plans to spend $1.8 million on those efforts this year, despite the CDC's recommendation that the state should invest nearly $111 million. That's just 1.6%, a rate that nationally, the group says, ties West Virginia for last place.
When we're able to fully fund the programs at the level CDC recommends, we know there's a direct correlation in decreased use rates and people's understanding of the harms.
Radke believes if Michigan lawmakers increased funds and passed a package of bills introduced last November in the state Senate that, if approved, would tax e-cigs and vapes and the sale of flavored products, require tobacco sellers to possess a license and more, the trends could change. She encourages lawmakers to consider their constituents and themselves as they get back to work.
We know exactly what policies work to reverse the trends we're seeing.
Those 8 bills included in the package mentioned in our story currently sit in committee. If they do get a hearing, Fox 17 will bring any updates both on air and online. Reporting in the studio, Marisa Oberle, Fox 17 News.